At the UC San Diego Health campus last week, a drone lifted into the air in a public demonstration. The hospital is testing out these four-armed aircraft to see if they can speed up medical supply delivery among clinics.
My name is James Colleen. I'm a physician at UC San Diego Health. I specialize in both emergency medicine as well as urgent care services. These lab specimens that would get drawn from patients would take for hours to get to our central lab for processing.
Urgent care facilities and clinics typically don't have labs, so patients may have to wait days to get their lab results back. While hospitals have a tube system that uses air pressure to shoot samples to a lab within a hospital facility, clinics have to send samples by car, which can take hours.
So say there's a patient who has diabetes, high blood pressure, some heart disease, and they get labs drawn. And then several hours later, or the next day, you find out that they have worsening kidney function.
So Colleen thought, why not try a different vehicle to speed this process up? In fact, doctors already know whether these aircraft will work. That's because UC San Diego is the second hospital system in the country to legally try out drones under a Federal Aviation Administration pilot project. The first was WakeMed in Raleigh, North Carolina.
So I'm Stuart Ginn. I'm the medical director of WakeMed Innovation. Beginning with just a very simple metrics on the front end, for the one little modest route we've got in place and flying, when we're flying, we see significant increases or decreases in the amount of time.
WakeMed has been doing this for a year now and has a few drones going one route. Ginn says it's too early to tell what the impact is now at a small scale, but he thinks there will be an impact as the hospitals get more drones.
It's really opened our minds about how we can connect our facilities together as a healthcare system. And the implications of that are enormous.
Ginn says a network of drones could mean hospitals can consolidate some services and save money and patient time. But he says it's still a new technology, so getting there will take time.
This is out in people's communities. And you can get clearance to fly, but where do you land?
That's why WakeMed teamed up with the drone company Matternet and delivery service UPS to make sure these drones are safe and monitored. Mark Taylor is with UPS.
The aircraft itself is equipped with a parachute. It flies on a predetermined path. It's geofenced. If it deviates at all, the parachute goes off.
Taylor says federal regulators and manufacturers will be gathering data as these initial drone programs progress.
Can again fly farther with heavier payloads.
And Matthew Genocitis, Chief Innovation Officer at UC San Diego Health, says the hospital is embracing the drone project because it means innovation.
You need to take a leap of faith. You need to have a vision. So I think that's the biggest challenge, and that's what we're all about at UC San Diego. You know, this is a university, this is an academic setting. We're all about trying to figure out what's next.
He says the hospital will evaluate the drone study when it's over and decide from there whether to integrate the aircraft into the system.
I think if this technology is successful, not only in healthcare but all over, I think we're going to see a lot more drones.
UPS and Matternet officials say they hope to work with federal regulators to extend drones to more hospitals in the country. Shalina Chatlani, KPBS News.